Thank you again so much for coming. We are going to record this so that people who could not be here are here. Thank you.
Hi, everyone. My name is Jessica Phillips, and I just want to say thanks to Bree and Linda and everyone else at the Arch and the Arch Network for inviting us. We have a lot of information to provide you. There's slides chock full of information, so we'll have time for questions at the end. The slides are numbered in case there's something you want to go over again. So this is about the basics of IRB work, your submission and prisoner regulations. Sorry, 1 second. So again, IRB basics, preparing your submission, the prisoner regulations, and then questions at the end. So IRB stands for Institutional Review Board. They're charged with protecting the rights and welfare of people participating in research. They're composed of different MDs, PhDs, RNs. It's also a requirement that there's an unaffiliated member and a non-scientist. At UCSF, the IRB is part of a larger department called the Human Research Protection Program, which is a pretty common organizational reality for most academic medical centers. And so at UCSF, we have 5 IRBs, one of which does the prisoner research and has the prisoner representative. And all our research is governed by multiple regulations. The 45 CFR 46, that section of the Code of Federal Regulation is operated by the Office of Human Research Protection. We'll go over that area the most, and it's under the Department of Health and Human Services. There's also FDA regulations, other federal laws, state laws, university policy, HIPAA. International research has some, but probably won't apply too much to prisoner items. The first thing you'll want to do is, I suggest that if you have a project in mind, keep it in mind as we go through these items, and that'll help develop any questions. Does your project meet the definition of human subjects research, which is how you know whether you need IRB approval or not? And that's broken down into the research itself, which is considered a systematic investigation leading to generalizable knowledge. And then the human part, which is a little bit easier. It is the actual individual, but it can also be their identifiable data. And then we want to work on determining your level of review for IRB purposes. And we start by looking at the level of risk. And the checkpoint or touchstone for this is going to the minimal risk definition. And this is the probability and magnitude of harm or discomfort you think the subject will experience in the research is not greater than the harm or discomfort the subject would normally encounter in daily life or during routine physical or psychological examinations or tests. And what's important to consider for prisoners is that this is not the daily life of prisoners, but rather unincarcerated volunteers. And then the risk level correlates to the review. So Expedited will be like our main touchstone. I'll briefly talk about exempt. As of 2018, there are some exempt categories. The categories are listed out, but we won't go over here because I believe each institution is deciding which exempt categories they would allow under exempt certification. Right now, I only know of University of Washington that has posted guidance on that. UCSF we actually are looking at everything under expedited review, even if it does follow in an exempt category. That could change. We could always discuss that if it comes up. So if it doesn't fall under that minimal risk category, it would go as greater than minimal risk and be under full committee review. To go deeper into expedited review, again, it's research that presents no more than minimal risk and fits into one of the federal expedited review categories. And that's what we'll go over. It's typically reviewed by 1 to 2 IRB members, but for prison research, it's different. So I really like the expedited categories because they're like nice and concrete. The first being approved drugs or devices. The second being blood samples. Here they say exactly how much blood, what types of participants, and how often. Anything greater than what's stated there would go into the full committee category. Category 3 is non-invasive specimen collection, like urine and hair samples. Category 4 is invasive clinical procedures, non-invasive clinical procedures, such as MRIs, EKGs. Typically, no radiation would go in this category. Category 5 is use of data or specimens for non-research, collected for non-research purposes. That's your chart review, specimen analysis. Category 6 is any recordings, and category 7 is your surveys, focus groups. There was one other, like interviews that would go under there. And just note, like any one project could have any combination of these categories, and maybe things that don't fit into this. So it's not like you can only do blood samplings, of course. And then for the full committee review, it's required when the research may present greater than minimal risk to subjects, or it's minimal risk, but it doesn't fit into the expedited review categories. Some examples of this are investigational drugs and devices, more than minimal risk interventions, observation of illegal behavior, and then vulnerable populations. So this is where prisoner research specifically comes in. And so it might vary from institution to institution, but what we do here is if your study fits into those expedited categories, you're indicating those, but as a matter of review, it would go to the full committee. And just to clarify, the full committee typically is those 5 or more of the PhD, MD, non-scientist, non-affiliated member. We typically probably have 10 or 11 people at a meeting, but then that's who's going to be looking at your research. And sometimes your research isn't human subjects at all. An example of that would be looking at de-identified or coded data, provided that you're not doing anything that requires FDA oversight, and you as the investigator never receive any identifiable data. So for FDA, that's typically if you're going to develop an assay or a drug or a device, FDA would need oversight over that. The 2 that where you never receive identifiable data, that's where a data use agreement would come into place that specifically says if you have coded data, you would never receive the key to the code. QI or public health surveillance are other examples of things that are not human subjects. There is more to this, but these are sort of the basic concept of it. But I would caution you that if you are looking at de-identified prison data, there are some state laws that might require IRB review for that. So always check with your institution. What do the members consider when reviewing a new study? They want to make sure that the risks to subjects are minimized, procedures are consistent with sound research design and not exposing to unnecessary risk. They want the risk-benefit ratio to be reasonable, recruitment fair, consent sought and documented appropriately, and provisions to protect privacy and confidentiality. So confidentiality has to do with data. Your own institution would likely provide you with what the requirements are here. Privacy has to do with your interaction with the individual. I think interviews are a good example of this. Zoom calls where other people might be listening. And obtaining consent has to do with folks voluntarily agreeing to be part of the study once they understand what will take place. You can have a waiver of signed consent. Again, for prisoner research, it might vary at your institution. And you can possibly waive informed consent altogether. This, again, check with your institution on this. This might be a good thing to have if the consent form is the only identifying document as part of the research. So the whole process, you submit your study to your IRB. It's screened by an analyst. It goes to the appropriate group to be reviewed. There might be changes needed, so it could be sent back to you. We call those stipulations. And depending on what the committee has decided, it might need to go back to the committee, or it could just go to one analyst to review your responses. Common findings in an IRB review are inconsistencies with these items between the application, different documents. Sometimes there's a failure to discuss risks or your procedures. Potentially, sorry, I lost my place. Not describing the alternatives to the research, or presenting an adequate data safety monitoring plan, or adequately describing all subject populations, or potentially overstating the benefits. In preparing for your submission, we highly recommend that you design your study prior to filling out the IRB application. Keep in mind any necessary scientific reviews, departmental and reviews. And meet with your IRB when you are discussing any complex areas like prisoners and prisoner law. There may be areas where you can learn about what's required and shift how you design your research. Another good point is differentiating between experimental versus standard of care. Again, consistency with documents is important. And then finally, my area of specialty, which is working out your collaborating sites. So you'll want to find out if they need IRB approval. If your study's federally funded, you're required to use a single IRB. And that means it's only the case if there's 2 or more sites engaged in the human subjects research. So you could have a site that is engaged, ones that's not, you just have one IRB. And then you might need a letter of support for any unengaged sites. These are some items that we really like to see, creating a plan for your staff in case there's turnover. Using lay language, not only in the consent form, but in your IRB submission, drawing pictures and using charts so that everybody understands your design on your team, not just so they can run the study, but also so they can answer any IRB questions. And then all your prisoner areas, and we'll go into that a little bit more detail here. So this is our local prison, San Quentin, and some prime real estate on the San Francisco Bay. And then this is heavy. It's a lot of information in one slide, but we'll go over it a little bit more in detail, but that way you have it and the link to find it. Prisoner means any individual voluntarily confined or detained in a penal institution. There's more to it than that. Here we have who is not a prisoner, someone on probation, wearing a monitoring device, receiving non-residential court-ordered substance abuse treatment and residing in the community, and or someone voluntarily admitted into an institution for treatment of a psychiatric illness. We certainly see different scenarios these days. So your IRB could contact the Office of Human Research Protection to confirm that we're understanding the definition correctly. Again, thick definition or thick information here, where the little I's are, those 4 are the categories that you're allowed to do research under the federal regulations. For the ARCH network, I would imagine it's number 2, might be very, very common, study of prisons as institutional structures or of prisoners as incarcerated persons, provided that the study presents no more than minimal risk and no more than an inconvenience to the subjects. So that's one. Number 4 might also be a category for you guys. And then there's this additional waiver for epidemiological research where everybody has to be a part of the research in order for it to be valid. Those 4 categories in this waiver are part of another certification that we'll mention later. And then everybody needs an emotional support dog when you're reading all the regulations. So this is just a quick break to get you a breath for the next section. So when you're reviewing prisoner research, you have to make sure that it falls under certain categories. And this is, let me just, sorry, I have to move an item there. That the research is not coercive, it's minimal risk. There's equitable selection. The research is presented to the prisoner in a language they understand, so get your translations or your interpreters. And the prisoner understands that their parole won't be affected if whether they participate in the research or not, and any follow-up care is provided. This, in terms of why we need the extra protection, it's basically to make sure that the prisoners are really doing the research voluntarily. Being incarcerated may not make that a straightforward question. And then there is another set of regulations for the Federal Bureau of Prisons. I did include the link because these regs are even lengthier, but they seem to sort of repeat themselves for certain areas: no medical experimentation, cosmetic research, pharmaceutical testing, etc. And then each state potentially has their own requirements for prisoner research. As an example, California does have the California Department of Corrections and Rehabilitation. There's also the Penal Code, but then there's our Bill of Rights, HIPAA, and another department that your research might just require that HIPAA applies or that the participant receive the experimental Bill of Rights. Again, this is something that your IRB would help you out, or potentially your legal counsel. And then finally, once you submit, get everything through the IRB will write to the Health and Human Services Secretary for the certification of your study. They go through these experts in penology and ethics, etc. When it's approved, it does get posted, but your IRB should be aware of that as well. And there should be a means to let you know so that once this is approved, you can begin your research. And that's all we have. So we have time for questions if anyone.
Jessica, thank you. You are a really clear public speaker. I've actually never heard anybody speak so eloquently about the IRB for, the so-called prisoner IRB modules. And so that was incredibly helpful. Thank you. I have a number of questions, but I suspect you all have questions as well. So I'm going to cede the floor first and see if others have questions, and just say thank you so much. Before I ask if anyone has any other questions, either Jackie, Erin, or Joel, if you had anything else that you want to make sure were underscored before we ask questions, please feel free to jump in.
I don't, Erin or Joel, is there anything you want to, as a, hardcore IRB admin side, anything you want to add or things to highlight from Jessica's comments?
I would just say that the quality of the prisoner reviewer does matter. I mean, not to sound crass, but I've been in a previous institution where the person just kind of had some vague experience with the prison system, whereas here at UCSF, I know we've got a couple of attorneys that are really knee deep in the process, and that matters.
Mm-hmm, mm-hmm.
I'll agree with that. And it also, I think, depends on their viewpoint as well. I've worked with prisoner representatives who were DAs, and they're going to have a very different perspective and a different viewpoint on prisoner research than, say, a defense attorney or a former prisoner even.
Mm-hmm.
So, that our regulations require that the prisoner representative have experience working with the population. But, it doesn't necessarily mean that that person has worked in a prison before, but so they might have different viewpoints and different questions for you depending on their personal experience.
Mm-hmm, mm-hmm. Yeah, those
That
are really
seems
good.
like
We would never allow a DA to be the prisoner rep. Whether that's fair or not, I suspect the committee chairs would decline that. But
But that would be a
you.
very interesting thought piece, actually, for somebody to write about creating a national metric for who can be and should be in the bare minimum qualifications around what that quote unquote prisoner representative should be. I think a lot of us would probably feel like that should be somebody who has personally had experience in a situation where they might be put at risk due to research and would have that perspective as well. So that could be a really interesting thought piece that somebody might want to write about, especially if it's not a national standard.
I think the one thing I would add is, I think a number of the projects that we've seen that are criminal justice associated have come from funding that was maybe a 2 or 3 page proposal that got some seed funding, and the person's then going to kind of start their research work. And that is fabulous. But if your IRB application is the first time that you're writing out your study proposal or your study protocol, you want to, I think the main pearl I would say is after you write it, all those different sections seem very painful and redundant, but in fact, they may very well have been what you would have put if you had done your NIH proposal and it had gotten funded. So after you write it, be sure get someone who is not a medical expert or not a psychology expert, but maybe has a reading level of at least 6th grade to go over the consent form. And if they understand what the heck you're talking about and what they're going to do, that's a really good metric for having a understandable consent. And then my second pearl is read your own application. Do not be embarrassed. Do not embarrass yourself by submitting something that's so disconnected from what the application says and the consent form says, that there's all these things that don't match up, and you end up getting back a lot of comments or stipulations. You can save yourself a lot of that by actually even the work in progress things that you guys do is probably a really good way of going through the form and the proposal in a way that it's consistent. So we love to give approval with like minimal comments, and also people get reputations. Bree happens to have a reputation of really well-written applications, so we don't sweat over the ones that
You
come
have to
from.
say that because I'm
No,
hosting
I
this.
mean it. I mean, I've read a ton of her stuff. But once you've done some really sloppy ones, believe me, the reviewers are like, oh yeah, okay, that's Justin just mailed it in. So fine. We're going to have to go all the way through this really carefully. Maybe even meet with them. So just your reputation matters. Read your own work, get someone else to read the consent form, and that will put you in such good stead as you do your submissions.
Thanks. That's great advice. Any questions? Like I said, I have a lot of them. So if you all don't ask, I'm going to start. So Larry's asking, are there ever correctional facility review boards that study protocols are reviewed through in addition to the academic institution? I can answer that and say California just instituted one about a month ago, which was a little bit of a shock for those of us who had proposals that have been ongoing for quite some time. Some of them are getting grandfathered in, but not all of them. So at a minimum, I can say that yes, in California they do. What about in like Rhode Island? Justin, that's a place that has a lot of research. Yeah, there you go.
Yes, we have a medical research advisory group that is a secondary review after IRB that's mostly to facilitate addressing logistical concerns in the facility, but also a lot of things that come up that maybe to transition into a question that I had that comes up a lot for us is compensation for incarcerated individuals and what is appropriate. And I feel like that comes up a lot in kind of ethical based questions. And I'm curious if the IRB at your institution weighs in on that or has good guidance on that, or what are some other recurrent themes that come up that I imagine trip people up, because that's one for us that is common.
Jackie, do you see that? I don't have much experience in that part. What do you think?
Yeah, so actually I mean, as a researcher, and this is another kind of caveat comment to say, the IRB wants to fit into the parameters of what's acceptable for the institution. And that's true whether you're doing international work and they want to work with the IRB on an international side, or in a way, I think prisoner research begins to sometimes feel like another international site where you don't necessarily, the culture is different and the regulations can be different. So we, to Justin's comment in particular, I think at UCSF, we were really trained by the San Francisco sheriff. And that sheriff said, I want my people to get the same sort of things that you would be giving people on the outside. If the jail in San Francisco, this won't be true in a lot of other places. Maybe the jail is part of the public health care system. And if you would be compensating, $20 to do your surveys and be involved in the study while they were incarcerated, then I want you to figure out how to put $20 on the books for the person, or a coupon they can redeem when they get out if they're going to get out. So that the answer to your question really had to do with local culture and the support of the sheriff, or in the case of a prison, the warden. Obviously the interpretation of what's coercive is extremely subjective. And I think, so we really took the notes from the folks that worked in the prison that were our supporters. They were letting us come in to do the research. So we knew that they had, some interest in mind. And so that's how it got set up. I'm wondering if other people on the call have had experience, or Erin, in your work with other sites.
I am familiar. There are some states that, at least for state prisons, prohibit compensation to prisoners for research purposes. Others, don't address it, and so I think the IRB would take into the same considerations, making sure that it's not coercive, which might be a different standard for a prisoner than a non-prisoner, depending on what the particular conditions in that prison would be, but
Mhm.
just be aware some states might prohibit it.
I think that's probably right. Joel, do you have any sense about like in Southern
Susan,
California?
I'm also wondering for Susan, do you,
Oh.
because I know that you've had a really
Oh, Susan.
long-standing big project in a different state than California, just very quickly before Joel goes. Susan, do you have?
Yes, I have that one DOC that I've been engaging in research in for probably the past 17, 18 years. But I've also done research in other DOCs and applied to some others that we didn't get into for whatever reason. And every DOC that I've ever applied to has had a research review committee of some sort. And we've never applied to say Hawaii or Alaska. So I hesitate to say all of them do. But I would say most, if not all, do in the US, and the federal system does as well. We also have applied to and been in one city jail. And the one for a big city fell under the public health department, as someone else alluded to. So they had a system, and they actually called it an IRB, which was the first I heard of one called an IRB. It's typically not in state system, but other ones have, like, if you're looking at jail websites, typically there's not even a process up on them for some of the ones I've looked at. So it's usually always very well articulated for the states, though, and also for the federal government. The other thing is I've run into, as I believe it was Aaron was speaking to, that I'm familiar with states that do prohibit any sort of incentives beyond, say, a certificate of appreciation or completion for both the folks who are incarcerated as well as for the staff. So not just the incarcerated folks, but the staff folks as well.
Yeah, I'm
Sometimes there's-
unclear as to the process in Southern California. I know my former institution, we shied away from prisoner research altogether. It just seems kind of complicated and risky down there. So, yeah, I'm not sure.
I think that the most important thing is when you're designing your study to really think this issue through very, very carefully. In our program, if we're doing research just that's like spitballing and thinking about what like hypothesis generating, and really like we're asking for people's time and thoughts and opinions, and we find a way to compensate always. When we're evaluating a project that we're doing, we generally just ask for people who are voluntarily willing to talk to us about whether or not the system of care that they're receiving is making sense for that this intervention is working. Because we don't want it to seem like we're paying them to tell us good things about the project that we're evaluating, that we're doing. But I think as long as you can really sit down and make a rational decision, and I love the article that Aaron put in. I have an article that we wrote years ago that I think we attached to this that talks a little bit about some of these issues, but this is another place that's really ripe, I think, for an updated kind of analysis of compensation, what compensation is. And just to remember that when you talk about things being coercive, that also can be seen as very patronizing. And so that there's you want to be careful not to be coercive. You also want to be careful not to make assumptions about being coercive. So there's, especially when you're giving somebody money for something that they would get on the outside if they participated. So a lot of really important things to think about. I have a question. What happens if you encounter a study, either you're asked to review a study or you hear about a study at a conference and you have concern that it was not performed, that may not have been ethical? Is there a place where you can review somebody's, is there a national repository of, like, you talked about the Department of Health and Human Services or something, like, is there a place where you can review an IRB that is not on one of your studies if you have concerns, or is that something that you should just shut your trap and not say anything about?
You can definitely report it to OHRP. I think there's other mechanisms or other areas to report it. I do know that in general, for any research, there's certainly groups that, mostly media groups, that would be interested to understand what was not done ethically, and they would potentially investigate it. I'm not sure, Erin, do you know of other areas to report?
I think the most common that we see is in the journals. I've seen a number of responses to journal publications where the author will write in and say, we question whether this was done ethically and here's why. But as far as actual, I don't know if sanctions is the right word, but to report it to a governing body, OHRP is usually the one that would oversee that, in the US at least.
There is, I would say also, at least all the, it depends on who approved the research. Usually in any kind of peer publication, they have to comment on that, whether it was examined or reviewed. And almost every IRB in the larger, both the privates and the academic ones, have a way you go on their website to submit a, letter of concern or complaint. And we've certainly been the recipient of concerns on some of the international research of like, how is it that you approved this kind of an approach? And we're take it very, very seriously. If someone is wondering if this was done appropriately or with full consent. You may not be able to get to the consent forms, as an outside questioner, but there's definitely both. So at the level of the IRB, in the peer journals, it's at the level of the authors, a way of raising the issue of appropriate ethics and safety.
At Penn State, there's a campaign, if you see something, say something, and it covers everything from research misconduct to questionable research issues, which would go to our Office for Research Protections. I just looked it up, but it also covers things like child abuse, sexual misconduct, a wide array of things, but they have a whole list of like where you reach out to for these different issues.
Thank you so much. I think Larry has a question, and please raise your hand if you have a question too. We're happy to get you in line.
Hi, this is related to, I think things, I come from a hospitalist background and we do a lot of QI work, and there seems to be kind of a, I don't know if it's a myth or true or just some general confusion around whether quality improvement related projects that then get written up in journals like still require IRB approval, or if they somehow can skirt around IRB approval. If that ever comes up. Or
I would say it probably depends on the journal. If it's a research journal, if you're calling it research, in my opinion, it requires IRB approval. Potentially the QI work could have been done without IRB approval, but then if there's a research question that it's answering or there was additional analysis, that portion would require IRB approval. I think if it's being published in a QI journal, you're probably mostly safe. But I think QI for prisoners, I have not seen a ton of that. Yeah, that's my take on it.
Since we're talking about time, and I'll wrap up.
I would just say, if you are doing quality improvement and you suspect you're going to want to publish the results, get IRB approval, because that will help you get all the things you need at that time, rather than trying to go back in time and getting consent potentially, or any other state approvals, etc. That's all I was going to say. And I guess to add to Jackie's, we can also, if it's not human subjects research, our IRB will make that determination, and the private IRBs would make that determination for you as well. So you have something in writing. Thanks.
And I think that this is, just to sort of sum it up, and I mean, so first of all, we could go on about this forever. And so one of the things I want to offer is that if you have questions that were not addressed here or thoughts that you want to share, Linda and I are happy to collate those questions and those comments and those thoughts. Maybe if we could run it by you all, your whole team, Jessica and Jackie and Joel and Erin, and have you weigh in on them from your perspective and send those back out. And so have this kind of continue as a conversation. We would really love to do that. It also, I think that there's at least 2 thought pieces that people on this call might want to write about, both about the question of compensation for people who are currently incarcerated, when, why not, how, and also the question of really this question of what to do when an IRB feels like they're holding knowledge hostage. And it feels like there's a secondary reason for something that would be approved in another place. And to that end, I wonder if another thing that we should be thinking about doing as a network is bringing together IRBs and having a conversation across, like maybe even asking IRBs to all review one IRB proposal. And seeing how different those IRBs are. I guess we have to consent them. We wouldn't maybe necessarily.
I mean, there's
write that.
studies,
That's
there's all
confusing,
kinds of
right?
interesting studies involving IRBs and time to approval. There's a national organization that meets annually, and there's an opportunity to present your work both in person and by poster. So that kind of a thing would be, I think, very interesting and very well received. Yeah.
So maybe it's something to really think about. If people are interested in that, in maybe talking with Jackie, and I can help to kind of facilitate that, and maybe talking to this national board and having some sort of a cross IRB conversation about what is acceptable and not acceptable in terms of knowledge sharing and allowing knowledge sharing, then maybe that would be something interesting to do. So if you're interested in that, contact me and I can try to facilitate that. And otherwise, just thank you all so much. We can't have these meetings just talking to ourselves. We need outside experts to come in and generate the conversation and give us information. And we're just so thankful to you all for joining us and for telling us about what you do and what works, and giving us a little more information in such a clearly articulated fashion about this crazy process. So thank you. And you are welcome to stay for Jen, but we understand if you can't. So,
but thank you.
Yeah, thank you so much.
Thank you, Ree, and everyone.
Thank you so much, Jessica.